Which of the following bacterial components is primarily responsible for severity of the patient's symptoms? So 1, I know that this is micro, so that's great. Number 2, I know this is about pathogenicity or severity of symptoms, not like immune invasion. Like this is about what causes the symptoms. So I have a 19-year-old college freshman living into a dorm, okay? In the emergency department, sudden onset fever, a headache, neck stiffness, and a rash on his trunk and extremities. Throw in that rash in there, and I'm worried about bacterial meningitis. They're super febrile, they're hypotensive, and they're tachycardic. So this patient is septic. Someone tapped them or did a lumbar puncture and got turbid CSF with an increased opening pressure, elevated neutrophils, decreased glucose. So I always remember that bacteria and fungi are the only two that really eat the glucose in the CSF. They gram stained it, and it shows gram-negative diplococci. When I think of meningitis and really anything gram-negative diplococci, Neisseria is the first thing that comes up. So is this Neisseria gonorrhea? No, it's not. It's Neisseria meningitidis. Okay, but that's not what the question asked me. It's, do I know what the bug is? Maybe you don't remember the name Neisseria meningitidis, but you likely remember the sketch. So again, what causes the severity, not the evasion? A polysaccharide capsule. Neisseria meningitidis totally has a capsule. I remember it. I was going to say, but capsules don't really do evasion. They do for pathogenicity. Not a ton, but this one I can't rule out right now because I do know that capsules help to cause the severity of symptoms. Lipooligosaccharide endotoxin, or LOS endotoxin. Well, toxins, typically like the staph toxin, they cause really sick presentations. So that one is up there for me too. Type 4 pili, that's more for like adhesion, and like that can be for evasion, whatnot, and it's unlikely. An IgA protease helps you adhere and maybe helps you evade immune to some extent, but that doesn't cause you to be super septic with meningococcemia. That's not what that causes. And beta-lactamase enzymes, that's antibiotic resistance. Sure, would that, help? Would that be a problem in this patient? Yeah, it would, but not in the context of this question. Very unlikely, 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 and it could either be A or B. Again, I know capsules cause pathogenicity, but I know there's a little letter, a little sign that says LOS, like it says lost and the LOS is capitalized. I know Neisseria meningitidis has this LOS toxin, and especially because it's a toxin, I think this is what's causing our poor 19-year-old's presentation. So I'm going to go with that one. It was LOS, like it says here, LOS, and this is the awesome part.